Guys, welcome back to Medical Coding with Blue. Today's episode is all about test day tips for the Ahima exams, the CCS, the CCA, the CCSP, the RHIT, and the RHIA. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so a little thing first. I'm just going to be talking about the Ahima exams today. I'm not going to be discussing the AAPC exams at all in this episode. So with that said, let's go. Okay, so hopefully you know which exam you're going to be sitting for, and hopefully you know that you have all of your appropriate books, the correct books. I'm going to be leaving the link for the Ahima website that talks about all the certification exams and the books that you need. Now, the CCS, the CCA, and the CCSP are all the medical coding certification exams. All of these do require you to have the appropriate books. And if you are sitting for it this year, this is 2022, you have to have the 2022 editions, okay? We are in September, gonna go into October right now, but you have to have the 2022 editions. Now, you can use the 2022 editions until April 30th of next year, okay? So that's the way it always goes. It always goes to the end of April, and then May 1st is when Ahima rolls over to the new current year books, okay? So even if you take your test in January, you will still have to use the 2022 editions. Now, it's going to tell you the year version books that you need, but you need to make sure that you go to the Ahima website and you look at the list of approved books, okay? Because I can tell you the books that I like. I prefer Optum 360 for your ICD-10 CM, your ICD-10 PCS, and of course, if you need your HCPCS book, I do prefer the Optum 360 edition as well. Now, for the CPT book, it has to be the CPT Professional Edition by the AMA, all right? But you have to, hands down, make sure that all of those books are the current year, all the years match, because they will not let you into the testing facility. All tests for Ahima are administered by Pearson VUE, and that is a third-party testing center where they have many different people who are sitting for different certifications, okay? It's not just medical coding that they do, but they also do the ones for teachers, sometimes I've seen them for real estate agents, and so on and so forth. So they test for everything. So keep this in mind. When you are going there and you're taking one of the 3 medical coding certifications, the CCS, the CCA, the CCSP, you must have your books with you the whole time. So when you're walking in there and they put you in the room to take the exam, you have to have those books with you. So just make sure that you need them, because you need them for the multiple choice section, and you also need them for the case study section. Because all of those exams, the CCS, CCA, CCSP, they're all broken into 2 sections, the multiple choice and the case studies. And you will need your books for the entire duration of the exam. Sometimes people don't know this, okay? So you want to make sure that you have all of your books with you, okay? Now, there is no, they do not want excessive writing. They do not want handmade tabs. If the tabs came with the books, it is totally okay to put them on there. The CPT Professional Edition by the AMA comes with its own set of tabs, so you can use those. However, I do not recommend tabbing, highlighting, or even writing in your book, because they will inspect your books. Some places have told me that they're very rigorous in how they inspect the books. So you never want to show up with the, your books all written in and highlighted and tabbed and all this good stuff, and then they tell you you can't test because you have too much writing in your books, okay? You want to make sure you go in there with your books clean. I always recommend having clean books because of the simple fact that if you are using the book appropriately to study with, you are not going to need additional notes. You will not have time to look at your additional notes. So just keep that in mind. Now, for my people who are sitting for the degree designations, the RHIT, which is the Registered Health Information Technician, that is the associates, right? Or the RHIA, the Registered Health Information Administrator, that is the bachelor's degree, you do not need coding books. when you go in there, you will be provided with all of the information, in order to make those selections if they're asking you questions about coding. This is why I say when it comes to the degree programs are designed for our leaders. They are not designed to be medical coders. Now, the RHITs, the associate's degree folks, they are the ones who are going to be more hands-on with the coders, but they are still part of leadership, okay? And so that's where their main concentration is. And if you don't know too much about it, you can look at the approved programs through CAHIM, right? I will leave that link in the description box as well. But when you look at these programs in college that are approved to be able to sit for the RHIT or the RHIA, you want to make sure that that's number one, that it's approved, because there are some programs that are not approved. So you want to make sure before you get to spending all that money on your education that you make sure that it is the approved program so that you can sit for the RHIT or the RHIA designation afterwards. With those exams, again, it is revolving around the management side, with the leadership side of the house. So that is something to keep in mind. That is why they don't need books. The RHIT and RHIA folks do not need books. And you can look at the Ahima website and it will tell you. When you look at the tab for the CCA, the CCS, or the CCSP, it will give you a list of the mandatory books. All right, all you have to do is click on that link. For the RHIT and the RHIA, it is not there. It will tell you the domains that are covered, and hopefully, if in your college program, they're going over this with you repetitively, what you need to know. So let's talk about the time that you have. None of the exams will allow for where you can hold on to it. What is it? Tabbing. No, flagging. Tabbing. Flagging. You cannot flag any of the questions on any of the CCA, CCS, CCSP, RHIA, or RHIT exams. You have to answer the question and move on. Before, there used to be where you could flag a question and go back to it, but it is no more, okay? They want you to be able to get to the question, make a decision, and move on. Here's the thing. The timing for each exams is going to be different. So depending on which certification you're going to be sitting for, hopefully you already know how much time you have. The CCA is a 2-hour exam, and don't let its size fool you folks. It packs a punch in those 2 hours. The CCS and the CCSP are both 4-hour exams. The RHIT is a 3.5-hour exam, and the RHIA is a 4-hour exam. So just make sure that when you are practicing, you are also working on your timing, your speed, because that is crucial in these exams. It is roughly average of 2 minutes per question. So because we have a range of questions on each exam, it's not like, oh, you have 200 questions. No, it is a range of questions, so we don't know. Every exam for Ahima is different. And so all candidates have different exams to protect the integrity of these exams. And so nobody can say, oh yeah, well, this was on the test or this was on the test, because nobody knows. It is going to be different for every single person. So that you have to know. Hopefully you have been working on your speed and you are not having those last minute jitters. I do recommend that, because these exams are administered through Pearson VUE, that you do a practice run the day before to make sure you know where you're going. You never want to be scheduled for an exam and not know where you have to show up to. So make sure that you take a drive there a couple days before, maybe the day before, know where you're going so you can orient yourself. That is going to bring down the anxiety a lot. These tests are very nerve-wracking, yes, but you can also do steps to mitigate those feelings of anxiety unnecessarily, right? Because if you know where you're going, that's going to take a lot of the pressure off, okay? The other things that you should know, being in this, that you go to Pearson VUE. I've gone to Pearson VUE 3 times for 3 different exams. CCA, the CCS, and the CCSP, and I've passed all of them. And let me tell you, my experience has always been really favorable. It's always been really good. But you have to go in there ahead of time, ahead of your scheduled time that you're supposed to be there. and you do a check-in. They say 30 minutes early. I try to make sure I'm there 45 minutes early because you never know, okay? So I go there, and I already know where I'm going to go, right? Because I know where the place is. And then you go and you let them inspect your books. They check you in, and they do all of that process. And again, they look at your books that you're bringing in. You cannot have any jewelry on, okay? They do say they do allow for a wedding band, but there is no jewelry, no watches, no rings, no necklaces, no earrings, no nothing, okay? No belts either. You have to make sure that you go in there, you know, very comfortably, but plain. No extras. If you, for ladies or guys even that put their hair up in a bun or something like that, you have to make sure that it is loose so they can see, because they don't even allow for big barrettes either, okay? So technically you should have your hair down so that you don't have to have all of that, because they will make you take it out, okay? So that's something that you have to know going in there. So just make sure that you're prepared. You can take a break. However, it does count against your time. The clock does not stop, folks. And when you go in and they take you into the actual testing center, once you need to leave or you need to take a break, you have to raise your hand and wait for the proctor to come in, because you are on camera and you have to wait for them to come and get you, so that you can take your break, or you can finish, tell them that you're done with your exam. So you can't just get up and leave. All right, that is very important, because you don't want to have your test results just zeroed out because you didn't follow directions. You know what I'm saying? So just make sure that you raise your hand and you wait for them to come in and collect you, and then you either check out or you go to the bathroom or whatever and come back, but just make sure that you know that. All right. It is so, the time is like, because I've already experienced this, the time when you're in those exams, it goes just like that. You don't have time to worry about like that you have to go to the bathroom or that you're thirsty or any of that. You don't have time. It is literally where you're on that exam and you are looking and getting through the questions and going through, because you don't have time to be thinking about anything else, because any of those precious minutes that are gone are gone. Now, when I took the CCSP exam early last year, the CCSP, I finished that in record time because I have been in the outpatient setting of medical coding for the last 13 years. And so I just breezed through that one. I had an hour and 20 minutes, an hour and 10 minutes left on the exam. But when I took my CCS exam at the end of the year, oh no, I had 8 minutes left on the clock. So I was sweating, trying to get done and trying to hurry up. Like, I wanted to make sure that I answered all the questions. And that's the thing. You have to look at the questions that you have, and you have to have it in your mind. Like, okay, if I really don't understand a question, if I really don't know, if this is a subject that I am really struggling with, like if you say, for instance, you don't know how to code cardio very well, and they give you a cardio question. Well, my advice is to go through, look at all the things that you have available, make your selection and move on, when you're in the multiple choice, so just make sure that you do that, so that way you can just get in and get out. That whole exam is not going to be that one question that you don't know, okay? So just make sure that you pick your best selection and move on. That's all you can do, because at the point where you're at the exam, you should be well versed in a lot of subjects. And you may not feel the most confident, but you have taken the time to learn. Hopefully you have. And hopefully you've taken all that prep time to be working on your speed, working on your terminology, learning your books, just learning the books themselves. Because a lot of people will waste time tabbing. And this is why I hate tabs. I will never, ever recommend tabs. And please save your comment if you're pro tab, because this is my channel and I'm going to tell you guys how to be successful, okay, in the way that has been helpful for me, okay? And I want to help people, and that's what I do, all right? If you want to help people, do your own thing. But for me, what I would say is this: when you have tabs, it's very easy to tear your books, tear the pages in your book. You can't have any tape in your book. So if you tear that page, that page has got to stay torn. And so that's why I say it's never good to have those tabs. In the 3 exams that I've taken, I've never had tabs. And I will always advocate for no tabs in the books. That's just me. But getting to know your books and looking at all the information that you have available, making sure that you have been reading your coding guidelines once per week while you've been studying, because that's going to help you be a faster reader. Again, these exams are about speed. And if you've been practicing on your reading speed and getting through these questions timely, it's going to set you up for success, okay? So that's what I would recommend when you're in that setting. If you don't know, you don't know. There's not a lot that you can do at that point other than use process of elimination and just do the best you can, all right? So that's why I say that's my advice there. And the other thing is, when you are in there, okay, there's going to be other people taking other exams. They are not the same as you. So don't feel discouraged if you see people come in and come out, because that's what happened to me as far as like people were going in and out when I was taking my exam. I didn't feel discouraged because I knew that people are taking other certification exams. I mean, they're wherever they're being tested on. Some people were in and out in 1 hour, you know, and I was the only one there. And so that was me for both exams. I was the only one left. And so it was just like, okay, and people were in and out taking their tests. And so don't feel discouraged if you see people going in and out, because it's not you. You need to pay attention to what you're doing, okay? I tell people, get a day of rest before. I really recommend a whole week off of no studying before your exam, but people don't like to listen to that one. They say, well, Bleu, no, I have to. If you are cramming all the way to the last minute, there's very few people who can cram before an exam and do well. Very few. But for the majority of people who are cramming at the last minute, it's not a favorable result. So take the time to relax before, a few days before your exam, at least 3 or 4 days before your exam, because by the time you get to that exam day, you're going to be like, okay, I'm refreshed, I'm ready to go, let's pass this exam. And that's what you want to do. You want to do that, but you got to be kind to yourself psychologically. You got to be kind to your body by getting rest, by not getting worked up, and by not being like, oh my God, hyperventilating because you are so scared and worried about this exam. The exam is just a final part of all of your studies. That's all it is. It's just a review. You are not walking in off the street with no knowledge. You are walking in with knowledge, okay? So that's what you got to know when you're going in there, okay? That you're going to be ready for this test, and you don't have to worry about not being prepared, because if you've been preparing like you're supposed to, the 20 hours a week, every week up until that exam, you are going to be ready for this test. The day of, you need to make sure that you have a breakfast. If you are somebody who likes to be an early riser, that's cool. You know, Pearson VUE has different times set up during the day to start the testing. I always start mine at noon. I am too scared to like think that I'm going to stay asleep. You know, even though it wouldn't happen, it's just me. But, you know, I would be more awake and more engaged if I start at noon. So that's why I've always started at noon, all right? To me, that just works better. Some people are early morning people, and some people are afternoon people, and that's okay. But you have to have enough time for the exam, just so you know that. When you are, that day of the exam, what I did for this, namely for the CCS, because that was the one where I was ready, but again, I did not have inpatient coding experience like in the real world. I had just had book experience. So I'm like, okay, we're going to do this. But you make sure that you have a good breakfast. I went and I had Wendy's for breakfast. You know, they have their breakfast menu for Wendy's, which I love. And I had a tea, because you don't want to have anything that's so high in caffeine that you're going to be like, zing! You know, some people need their coffee. If you need coffee, drink a small coffee. You don't want to have excessive caffeine when you're already on 10 with this test, and you want to make sure that you go in there and you are calm. So I calmly had my breakfast. I calmly had my my tea, and I watched Monk. I was watching Monk at the time. I think I was watching it on Prime. Not an ad for Prime, but I was watching it on Prime, and I was like, you know, just laughing at the episode or whatever, because that was helping me to stay calm and to be relaxed. And I had actually taken 2 days off from work. I took the day of the exam and the day before the exam off from work, because for me, I want I don't want nothing in my head. I want no distractions. Nothing. I don't want any vibes around. I want to be calm, cool, and collected, and that's what I did. The day before and the day of, I took off so that way I could have it be okay, and that's what I did. And it was favorable all 3 times. So that's the thing, that you want to set yourself up for success on that. Again, don't get overworked up on things that you don't need to. The domains are there, and don't go into these Facebook medical coding groups, guys. Please don't do that, because they're all going to have different experiences, and a lot of these people that go in there and complain, that say that, you know, maybe they didn't have a favorable result on their exam, it is because either they let their nerves get the better of them, or they listened to somebody they shouldn't have listened to, and it's just a whole mess of things. Concentrate on yourself. Before I wrap this one up, if you are sitting for the RHIT exam, the Registered Health Information Technician, if you are in the associate's degree program, beginning October the 1st, which is just a few days away, they're going to go into beta testing, which means that nobody will get their answers for if they passed or not right away, like the other exams. When they're not in a beta testing mode, you will get your printout of your results right away for the CCS, CCA, CCSP, the RHIA currently, all of those, okay? You'll get your immediate results. But for the RHIT, starting October the 1st, 2022, the beta exam results will only be provided following the examination review and determination of the passing standard. The time between the end of the examination administration period and the release of the scores to the candidates will be up to 10 weeks. 10 miserable weeks. You're just waiting, you know. Please do not contact Ahima or Pearson VUE during this time. All beta candidates will receive an email notification when their results are read. So if you are going to sit for the RHIT exam after October the 1st, just know you are not going to get your results right away, and that you may have to wait up to 10 weeks for those results. So just so you know, but if you are with the other exams, you will know right away. It will tell you if you passed or if you failed, and it will also break down the domains and telling you like what you scored in each domain. Okay, so hopefully that can give you some comfort. If you know that you need to go back again and do the test again, it's totally fine, guys. Just know that when you go for these exams, it tests your competence, and your competence is along with your confidence, because your confidence is what's going to help you too. If you sit there and second guess yourself, again, you're setting yourself up to fail. Don't do that, guys. You got to be sure of yourself. You got to be sure of what you are coding and the codes that you are selecting. So study, 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 because that's all you can do at this point. Anyway, I'm going to wrap this one up. Thank you guys so much for joining me. Best wishes to you on your exams. If you are going to be sitting for them pretty soon, let me know so I can celebrate with you. And if you've been studying, make sure you leave a blue heart. If you like this video, please like, subscribe, share, and I will see you guys next time. Bye.